Well, look, I think it's been so far so good. We're seeing a bump up in cases and hospitalizations, but we expected that. Certain states, you look at what's happening in District of Columbia, Virginia, Maryland, you see a slight increase. Alabama, Mississippi, Florida and Georgia were showing bump ups. The data was flat over the weekend. Reporting around the weekends is notoriously unreliable. You get underreporting around the weekend. So you really need to look at this on a week-by-week basis and smooth out the data. We did see an uptick last week after 2 weeks of declines in hospitalizations, and that's really what we're focused on. And we're probably going to see some increases going into the summer. But I think as we get into the summer and a seasonal effect starts to take hold, hopefully that's going to be a backstop against spread and we can do this successfully. This is why governors prescribe doing this in stages so that we can look at the data and adjust if we need to.
You said today that you're concerned that some are looking at this as if it's an all clear. Were you referring to those photos and some of them over the weekend of large crowds gathering in some places, shoulder to shoulder, no masks?
Well, look, I think the biggest risk right now is that we become complacent. People feel pent up. They want to get out. I understand that. I did, too, over the weekend. But we need to still be careful when we go out. We need to try to reduce the number of times we go out. We need to be careful of our social interactions. We should be wearing masks and practicing good hygiene. If people do that on a wide basis, that could really have an impact on the spread of the continued spread of this virus. But if people become complacent about those kinds of steps, that's when we could start to see the viral transmission really start to pick up.
Professor Jeremy Siegel, Dr. Gottlieb of the Wharton School, University of Pennsylvania, was on my noon show earlier today, said the following about the shutdowns. I'd like you to listen to that, and then if we could respond to that on the other side.
I think in retrospect, we will look at the lockdowns as the wrong policy. Social distancing, masks were right, and the CDC was really slow off the mark on that. We could have kept many more enterprises open and relieved much of the seriousness, not all of it, of course. But history will show that we really, unfortunately, did not follow the right policy.
Wondering what you think of that, Dr. Gottlieb, and whether the lockdowns went too far.
Well, look, I think history is going to show something else. I think in the cities like New York, Detroit, Chicago, New Orleans, where there was really epidemic spread and it was out of control, we had no choice but to put in place the stay-at-home orders and the very stringent measures that we took. The healthcare systems were effectively overwhelmed. New York City, for a period of time, was a COVID-only healthcare system. You couldn't get medical care outside of an emergency or COVID illness. And so we needed to break the epidemic in the cities where it was epidemic. I think the challenge was we didn't know where it was spreading. We didn't know where the epidemic was going to go to next because we just didn't have good information. We didn't have the testing in place. We didn't have reliable data. So we had to reach for a simultaneous national shutdown effectively because we couldn't target those interventions. Hopefully going into the fall, we're going to have outbreaks in the fall, and we'll probably have cities that become epidemic. Hopefully we can target our interventions much more effectively because we'll know where the virus is spreading and we'll know where it isn't. And we'll be able to titrate our approach based on how much background transmission there is, and we'll be in a better position. That's what we should be focusing on, trying to get those tools and interventions in place so that we don't have to reach for a simultaneous national shutdown when we have 5, 6, 7 cities become epidemic, perhaps in the fall.
Talked about Georgia earlier, seeing a small uptick in hospitalizations. Georgia, of course, was the first state, Dr. Gottlieb, to reopen. And since late April, the growth in new cases there is actually pretty flat. And some would say that's evidence that perhaps we did go too far.
Well, look, there are states that have done this successfully. And if you look at Georgia and Florida, you saw an uptick in the hospitalizations in the last week. We have to see what the data shows over the weekend. But you haven't seen a major surge in infections. This could be a seasonal effect because you're seeing across the Sun Belt and in the South, infections not really go up as those states reopen, and infections never really took off in certain states. We'll have to wait and see. I'm hopeful that, these states can pull this off successfully. We want to see that happen across the entire country. I think as we go into the summer, as we go into July and August, we are going to see transmission break off, and we can all take a little bit of a breather. That's what happened in 2009 with H1N1, which was also epidemic going into June. We really saw cases collapse in July and August. They came back in the fall, but we were all able to take a breather over that summer.
And hopefully we'll be ready for it this time versus the onset of this from the beginning.
Right.
You said today that we need to define what a, quote, a new normal is. And I'm wondering what your definition of a new normal is tonight.
Well, I think initially we need to implement the measures that we're doing right now. The social distancing, the mask wearing, people cutting down on their activity, trying to group shopping visits, being mindful of who's in their social circle. Hopefully, as we continue and as we get a better sense of where this virus is and isn't spreading, and as transmission comes down, we can all relax a little bit more. But I think there are certain things that we're going to do in perpetuity going forward. I think mask wearing is going to become far more common. I think we're going to de-densify offices. I think we're going to look for ways to try to de-densify schools and maybe not have entire populations of students intermingle, but keep kids in smaller groups within the schools. I think that telework is going to become more popular, more the norm. I think you're going to see office-based work start to diminish. People are going to not want to go into cities for office-based work. I think you're going to see a lot of things change in terms of what we do. Some of that's going to probably be permanent, and some of it's going to be a temporary phenomenon until we get to a vaccine and we can, get to a point where we have more immunity in the population, and this is less of a threat. We will get there. This will eventually be less of a threat. But we're probably going to have to get through one more cycle with this in the fall and maybe going into the winter until we get to the other side.